Um, Good evening, all. You're welcome to today's presentation on medication errors and prevention. What are medication errors? And when we talk about errors, they can definitely cause harm. And when we talk about errors also, they are also preventable. There are different types of medication errors. All these and more we're going to talk about in today's presentation titled Medication Errors and Prevention. And our presenter is our very own pharmacist Boladale Rafiu from the Pharmacy Department, UITH Ilorin. My name is Leila Aliu from the Department of Clinical Pharmacy, University of Ilorin. Pharmacist Boladale, over to you, please.
Thank you. Good evening, everyone. Our protocol duly observed. Special greeting to the fellow in our midst, and our Director of Pharmacies, I.K. Bello. Today, I will be speaking on medication errors and prevention. As the moderator said, there are so many medication errors that occur in our day-to-day activities. So today we look into some of those type of medication errors. The topic outline for my presentation include introductions, definition of medication errors, classification, causes and consequence of medication errors, detecting and reporting medication errors, prevention of medication errors, conclusion. Next, introduction. Medication errors pose significant patient risk. This error can occur in almost any healthcare setting, including hospitals, clinics, medical offices, nurses' home, pharmacies, and patient home. What is an error? An error is something incorrectly done through ignorance. An error is also a mistake, either in dose calculation, in judgment, in speech when counseling patients, in writing when labeling prescribed drugs for patients, or in action during the course of dispensing. An error can also be defined as a failure to complete a planned action as intended. Now, what is medication error? There are many definitions for medication errors, among which I have this very simple definition that goes like this. Medication errors can be defined as a failure in the treatment process that lead to or has the potential to cause harm to the patient. The United States National Coordinating Council for Medication Error Reporting and Prevention define medication error as follows. Any preventable event that may cause or lead to inappropriate medication use or patient harm while the medication is in the control of healthcare professional, patient, or consumer. Such events may be related to professional practice, healthcare products, procedure, system including prescribing, order communication, packaging, compounding, dispensing, administration, education, monitoring, and uses. This definition captures most of the stages in which medication error can occur. Thus, when we are going to be talking about prevention of medication errors, we'll be looking at these stages that is involved in medication therapy so that we can tackle the error from the initial stage till reach the patient stage. Next is classification of medication errors. There are different approaches to classify medication errors. For this course of presentation, I have listed 4 major approaches. Approach A is classification based on the stage in the sequence of medication use process. Another approach is psychological classification. The next one is based on level of severity of the harm that occur due to medication error. And the last approach is based on type of error occurring, such as is it a wrong medication, wrong dose, or wrong frequency, or wrong administration route, or wrong patient was being given the medication. Now let's go detail into the first approach, which is based on the sequence of medication use processes. Medication error can occur when choosing a medicine in form of irrational, inappropriate prescribing. The medication error can also occur when writing prescription in form of prescription errors such as illegible handwritings. Also, doing compounding of the formulation to be used by the patient. Errors will occur in form of wrong strength, contaminants, wrong or misleading packaging. The next, during the process of dispensing the formulation, medication error can occur in form of wrong drugs, wrong formulation, or wrong label. Also, in the course of administering the medication to the patient, error could occur in form of wrong drugs, wrong routes, wrong frequency, or wrong duration. Also, during the monitoring therapy stage of medication, error could occur when the physician or the nursing care fail to alter therapy when required. The second approach, which is psychological classification, is also further divided into four major subsets. The first is knowledge-based error, and this occurs purely due to lack of knowledge, that is, ignorance. For instance, this prescription I'm sharing on this slide, it shows the prescriber requesting for IV Rocephin 1 gram 12 hourly for 24 hours. On the same prescription for the same patient, the prescriber is also asking for IV Tandac 1.5 gram 12 hourly for 24 hours. This clearly shows that the prescriber lack the knowledge of the content of either the Rocephin or the Tandac. As we all know, the Rocephin contains the active pharmaceutical ingredient known as kefurazole. Likewise, the Tandac is a combination of kefurazole 1000 milligrams, same as that of Rocephin, and tazobactam, which is 500 milligrams, what make it we get 1.5 gram as the dose. Also, medication error in form of knowledge-based error is occurred when pharmacy is unaware of the interaction between medication. For instance, when you see a prescription where warfarin and erythromycin are combined to be administered for the same patients, you should all know that yes, the warfarin and the erythromycin will have a drug interaction with the erythromycin affecting the bioavailability and the metabolism of warfarin. Next, under the psychological approach, is a rule-based error, and this occurs when you misapply a good rule. For instance, we all know an ID prescription is written with the dosage form of the medication, the name of the medication in generic form, followed by the dose and the frequency, and last, the duration for the therapy. Now, this prescription I'm sharing here shows the prescriber requesting for tablet PCN, although it's in abbreviation, which is partially accepted, but the dose here is being written in Roman figure 2, which does not give any meaning to the drug that is being requested. What does the Roman figure 2 mean? Does it mean 0.5 milligram, or does it mean the 1000 milligram? So this type of error is what we classify as a rule-based error. The next under the psychological classification is what we call the memory-based error. And that can also be referred to as when you forgot to do what is ideal to do. For instance, we all know a dispensing envelope has a place where a name of the medication must be written. Likewise, where the dose of the medication must also be written, and the frequency, how the patient will take it, we have to be written on the dispensing envelope. Now look at this scenario where a patient that is hypertensive come to a premise and it was prescribed amlodipine 5 milligram, lisinopril 5 milligram, nifedipine 20 milligram BD, and the pharmacist gave the patient the medication in this form, putting the sachet of this medication into the dispensing envelope and indicating the how to use the medication alone without writing the name of those medication on the dispensing envelope. And by the time the patient got home, the drugs are mixed up. Now it's not left for the patient to know how is he going to know which drug belong to which dispensing envelope. And this will actually give rise to medication error, either in form of him taking the nifedipine that's supposed to be BD to be taken once daily and now be taking the amlodipine BD. Also, for a drug that have as require that is requested or as a require or the PRN drugs used one occasional, forgetting to specify a maximal daily dose to the client can also lead to a medication error. The first subset of the psychological classification is what we refer to as the action-based error. And this could occur, for instance, when you intend to dispense tablets coaferamine, that's Piriton, to a patient, but you end up dispensing tablet copomazine, the antipsychotic. You see, because the drug in the name, you can see they look more alike, and this could have arise either due to the prescription being sent to the pharmacy and the writing of the prescriber was not clear, and you end up guessing whether he's trying to write the coaferamide or he's copomazine. So in guessing, when you guess for a prescription that is not clear, there is high chance of committing medication error. In this kind of case, it's best to refer back to the physician for clarity. Under the action-based error, we have another subset that is referred to as technical error. And this happens, for instance, you want to give 10 tablets of vasopressor for a patient, and you end up giving the patient 15 tablets. You've already added more tablets to the patient, and maybe you cost the patient for 10 tablets. You've already committed an error, and that error will have economic effects on the system. Also, the writing of the physician or the prescriber can also be categorized under this technical error. Just like this prescription that is showing tablet, the first name you can see, is it Notain, is it Noflex? There is a lot of drugs that come into the mind when you see something like this. And moreover, you can see it's not specifying the dosage. So you can't even guess right in this form. So this kind of prescription, the best solution to correct it is to refer back to the physician. So next is the third approaches of classification of medication error, which is based on the severity of the harm that have occurred due to medication error. This is further categorized into category A to I. That's 9 different categories. The category A, there is no error. Error does not occur, but there is capacity for an error to occur. For instance, when you tell a patient to take his or her medication 2 times daily, and the patient decides to take the first dose at 8 a.m. in the morning and the second dose at 10 a.m. in the morning, the patient has fulfilled your instruction of taking 2 times a day. But by the time you give the most appropriate by saying 12 hourly, then the patient will know that the 2 times daily actually is for 12-hour interval for him to take the medication. 2 times daily, no error, but it has capacity to cause error. The next category is category B. Error occur, but this error did not reach the patient. For instance, a patient that was prescribed syrup paracetamol 1 gram 8 hourly for 3 days. From this prescription, you agree with me, it's only the dosage from which is the syrup that look odd in this prescription. Now, after you crack the patient and you discover the patient is not having any difficulty in swallowing, but a mistake has occurred, instead of being tablets, the prescriber mistakenly wrote syrup. So in this kind of medication error, you won't alert it to reach the patient. You will only change the syrup to tablet, and you document it and reach out to the doctor for also correction. The category C is in form of an error occur, and this error reach the patient, but is like unlikely to cause any harm to the patient. For instance, a patient that come to take order and you mistakenly dispense multivitamin into his drug, whereas the multivitamin was not included. We all know the multivitamin will not cause any harm to this patient. But yes, an error have occurred, and this error have already reached the patient. The next category, which is category D, is an error that occur, but it could have to necessitate monitoring to preclude harm. For instance, a patient that is on the control release metoprolol, that's an antihypertensive, and now you mistakenly dispense a regular release metoprolol to this patient. There is high chance for this patient to enter hypotensive crisis. But by the time you monitor this patient, you're able to prevent this hypertension to set in. So that kind of error is classified into category D based on the level of severity. The fifth one is a category E, which is an error that occurred and it has reached the patient and have caused a temporary harm to the patient. For instance, a patient that was on a antihypertensive and you mistakenly forgot to give he or her his antihypertensive drug, and health have occurred. But because he's not able to take that drug for the BP, for the hypertension control, we all know the hypertension will continue to do a minimal harm gradually into the body of the patient. So that kind of error is category E. The next one is category F. This is an error that have occurred and will have caused harm, a temporary harm to the patient, which will require either initial or prolonged hospitalization. For instance, anticoagulants was ordered daily when patients take it every other day. The last stage of the categories of classification based on the level of severity is the G, H, and I. In all these cases, an error have occurred, and this error have reached the patient. The patient have already taken this medication. The category G have causes a permanent harm to the patient, while the category H could have necessitated intervention to sustain life, but the category I have already resulted in the death of the patient. For instance, when mistakenly giving high dose of digoxin to a patient that is hypertensive. So the next on this presentation, I looked at these causes of medication error. What are the causes of medication errors? There are a lot of studies that are trying to find what factors influences medication error to occur. And these factors are further being grouped into factors associated with the healthcare professional. We have those that is associated with the work environment. We have those that is associated with the patient himself, and we have those that is associated with the medicine itself, that the medication. Now, under the factor associated with the healthcare professional, we have one, lack of therapeutic training or inadequate drug knowledge and experience. Also, inadequate knowledge of the patients, poor communication between healthcare professional and patient are some of these factors that are associated with the healthcare professional that could have led to high chance of medication error to occur in the form of medication therapy. The next is factors that is associated with the patient itself. We have the patient characteristic in form of the patient personality and the patient literacy. Also, the language barrier is very important factors that can lead to medication error to occur. Also, the complexity of the clinical case that is being treated. For example, those patients that have multiple health conditions, and that will have warranted to have what we call many drugs, the polypharmacy. And the more the drugs, the high chance of medication error to occur. Now, the next one is factors that have to deal with the medicine itself. especially when we talk of the names of the medicine. That's why an ID prescription is said to be written in the generic name of the drug. But in the case where we have drug being written in the brand name, then we have high chance of medication error to occur. Also, doing labeling and packaging. There are some drugs that they are labeled and packaged. They are too similar to each other that if you don't take, if we are not careful enough, they will give right to, they will make someone to commit a medication error. The next one is factors that have to do with the work environment and will contribute to medication error to occur. We have issue with the physical work environment, like the lighting. The lighting in some pharmacies, premises, the temperature in which the pharmacist is working, or the prescriber or the uh, other healthcare provider are working, can also be attributed to have caused them to commit medication error. Also, insufficient resources and work overload and time pressures are some of the factors that have that are associated with the work environment that contribute to medication error to occur. Next is the consequence of medication errors. As you can see, based on the category of the level of severity, there are different stages of consequence that can occur due to medication error, depending on that category. We have adverse drugs reaction. Yes, most drugs actually causes adverse drug reaction, but with the event of medication error, there is high chance of this adverse drug reaction to occur. Also, the drug-to-drug interaction, and this will lead to lack of efficacy and suboptimal patient care. And also, when you have a medication error occurring on the part of the patient, that will give rise to suboptimal patient adherence and poor quality of life. And all these outcomes have significant health and economic consequences, including the increase of use of healthcare service, preventable medication-related hospital admission, and death. The next is detecting and reporting medication error. The fear of disciplinary procedure by those involved constitutes an obstacles in reporting medication error. But the reporting of medication error should be encouraged. Use this error report to identify area of likeless occurrences and simplify and standardize the step in the treatment processes. An ideal medication reporting system should be readily accessible with clear information on how to report a medication error, and the reporting should be followed by feedback. What are the steps that can be carried out in preventing medication error? The first is education. Just like we know, the knowledge-based error is due to ignorance. So educating the healthcare provider is a key element to reducing medication error. And also ensuring that the physician adhere to standard treatment guidelines when prescribing, which is another way of preventing medication error or occurring. Also, the use of technology such as computerized prescribing system, barcode medication system, and advanced pharmaceutical practice such as medication reconciliation, medication therapy management, all these advanced pharmaceutical practice, when instituted in the pharmacies or in the hospital setting, will actually help in detecting about drug therapy problem, and this will also reduce and prevent medication error for occurring. So in the next the next remaining slide, I will be talking about approaches that can be employed in reducing this error based on the stages involved in medication therapy. We have one approaches to reduce prescribing error. To achieve a balanced prescription, this following question need to be asked. One, indication. Is there an indication for this drug? And if there is an indication, what are the drugs that will be very effective in combining this indication? And hope this drug you are writing does not is not going to cause a drug to drug. Hope that is not going to be drug to drug interaction. Or is there any similar drug that is more effective than this that you have prescribed? The next is disease condition itself. Are there any important probability that could affect the response to the drugs. Also, the dosage form. What is the correct dosage regimen when you are prescribing? What period? What is the appropriate duration of therapy? And the economics. Is the drug cost effective? Next is approaches that can be steps that can be used in reducing dispensing error. Firstly is by introducing a safe systematic procedure for dispensing medicine in the pharmacy. Medication is very, very important to check for drug therapy program and be aware of ambiguous orders or drug names, especially the high-risk medication, those that have no therapeutic intent. And when you see an order that is not put there for you, kindly refer back to the physician for clarity. Also, ensure that each medication are labeled correctly and counsel the patient appropriately. Approaches to reduce drug administration error include, but not limited to this following. First, check the patient identity. Next is to ensure that the prescription, drug, and patient are in the same place in order that they may be checked against one another, and ensuring that this medication is given at the correct time. So the last slide, conclusion. To maintain patient safety and avoid medication error, it is important that physicians, pharmacists, nurses, and other healthcare professionals adhere to the standard for safe medication practice, known as the 5 rights of medication use: the right patient, the right drug, the right dose, at the right time, and to the right route. Thank you very much. These are my references. And thank you very much for your attention.
Thank you, pharmacist Boladele. That was a very good presentation. As we can see, the consequence of medication error. Medication error is basically failure in the treatment process that can lead to or has the potential to cause harm to the patient. When we're dispensing medications, when we're diagnosing, everything revolves around the patient. So if we can get the process right, proper diagnosis, proper treatment, correct diagnosis, and correct medication to the patient, that can also reduce medication error. We have seen the different types of medication errors. The consequence of medication errors include adverse drug reaction, drug-drug interaction, lack of patient adherence, and poor quality of life. And among the prevention of medication errors include education of healthcare providers. Now, all these ones together will definitely reduce medication error and prevent harm from getting to the patient. Thank you once again to pharmacist Boladele for the wonderful presentation today. If there's any question you want to ask, if anybody have any question you want to chip in, any question, comment, or contribution, the floor is open for any question, comments, or contribution. Pharmacist Alege. Yes, sir.
Can the speaker stop sharing the slides? Pharmacist Baradele.
Sir, I'm here.
Sharing? Yeah.
I can stop sharing.
Are you hearing me?
Yes, clear.
Okay.
Clear and loud.
Yeah, thank you very much for this wonderful opportunity. I want to thank you, the organizer, for coming up with this beautiful topic. And I want to commend the pharmacist Boladele for the beautiful presentation. No doubt, it's a well-researched one, and I didn't expect anything less from him. I would have wished we have more pharmacists to listen to this. The attendance has been very poor, but it's been recorded. I hope quite a number of us will benefit from this presentation. So I say thank you, Bola Dale, and well done. Thank you.
Thank you very much,
Hello.
sir. Yes, we
Thank
can
you
hear you,
very
sir. Thank you very much, sir, Pharmacist Alege, for that wonderful contribution.
Thank you very much, sir.
Well done.
Equally, I want to join hands in commending pharmacist Boradale for that beautiful presentation. Unfortunately, the attendance is so poor, and this error concerns everybody. Be you a hospital pharmacist, a community pharmacist. We all deals with drugs, and we can commit one error or the other. One of the consequences, if we to mention, is the legal consequence. If you commit an error that leads to death or permanent injury to a patient, that could lead to a legal action. So you need to include that in your slide. Well done. Had a very good one.
Okay, sir.
Yeah.
Thank you, Pharmacist Dr. Ike Bello, for that contribution. Anybody, the floor is still open for more contribution, comments. Pharmacist Yusuf Ahmed Tijani, are you there?
Yes, I'm here.
Yes, we're listening to your own contribution, please.
Okay, I think I can only commend the speaker for a well research and presentation, just like my Oga said earlier. So it's well impacting, and I will as well implore the co-host of this this presentation to extend this to our other colleagues out there. So thank you for this wonderful presentation.
Thank you, Pharmacist Yusuf. Yes, the presentation is well thought out and well presented. Thank you, Pharmacist Yusuf Ahmed. Pharmacist Fumilayo Ologe, we want your contribution. Pharmacist Fumilayo.
Okay, thank you. Good evening, everyone. Yes. Good evening, everyone.
Good evening.
Good evening, dear colleagues.
Evening, ma. Welcome, ma.
Thank you. I just want to appreciate the effort of the Clinical Pharmacists Association of Nigeria to bring these Zoom seminars from time to time. Also, I want to commend the efforts of pharmacist Bola Dale. And I want to also add that there could be other after effects of medication errors. And I think Fambilo already mentioned the legal aspects. There could be adverse events which could be fatal, which I think he has also mentioned. So it's a beautiful, well-rounded presentation. I want to commend your efforts again, Fambola Dale. And I don't know what we can do to increase attendance. I don't attend regularly, but the last time I attended too, the attendance was not really, it wasn't so encouraging. So thank you very much for the opportunity to speak. Hello?
Thank you very much, ma'am. Yes. Yes, ma'am, we can hear you.
Okay.
Yes. Thank you very much, ma'am.
I'm done.
Okay, ma'am. You're phasing out. We barely hear you.
Thank you.
Thank you very much, ma'am, for that.
Comments or
Yes, yes, ma'am. Very valid contribution. Like our guys have said that people are not getting enlightened. It behoves us to reduce. There's no way we cannot do without error, but it behoves us as pharmacists to reduce medication error as much as possible because of the legal action. People are getting very enlightened these days. If you're supposed to dispense chlorpheniramine and you give chlorpromazine, taking that is very devastating. The side effect consequence of taking chlorpromazine instead of ferritin is very devastating, and the legal consequence is also huge. So as pharmacists, it behoves us to always make sure that we give the right drug to the right patient. And if there's any error with the prescription, always reach out to the prescriber. If there is any drugs these days, the names are always looking alike, the packaging are always looking alike. So if there's any error, especially with the prescription, we should reach out to the prescriber to make the necessary correction, as Dr. Ike Bello have said rightly. And also, we should also, okay, Ma, you want to say something?
yes.
Yes, Ma, go ahead.
Yes, it occurred to me just now that are there apps
Okay.
that can help be recommended to pharmacists?
Apps recommended to pharmacists.
Yes, are there apps that can help one detect medication errors easily? You know, I don't know whether it happens to other people, but you know, there are times when you get a prescription and those errors are not so obvious. And if you are working under pressure, you might actually miss attending to that particular error.
Okay.
So are there apps that can help pharmacists in this area?
Yes, absolutely.
Yes.
There is the drug interaction checker. There are lots of drug interaction checker. And the one I am most conversant with is Lexicomp. Yes, Hippocrates. Those ones can give you detailed information about any drug interaction, bioavailability, pharmacokinetics of the medication, and even when it comes to pathophysiology, they have some pathophysiology in Lexicom app, and mostly for drug interaction. So that, and it's even on the phone. It's even on devices. You can just, except that it's a bit expensive. I think 35,000 naira. If you convert the money, dollar equivalent to naira, is about 35,000 naira per year. Maybe a bit pricey, but Lexicomp is a very good drug interaction checker where you can have IV compatibility is also there for pediatrics, for O1G, for gynecology. Basically, all the O1G, pediatrics, gynecology, oncology also is also there, and IV compatibility, and treatment for poisons is also there. So yes, you can have it handheld, but it's a bit pricey. And then with the dollar increase, it may, it's fluctuating, but between 35,000 naira per year for some of these online mobile apps.
All right, thank you.
Thank you, ma'am.
And in addition to that, Dr. Lila, we usually have a Medscape, which is free,
Medscape.
and
Okay.
a drugs.com. They are free apps. Even Hippocrates is equally free. It's only Lexicon that is you have to subscribe to. And like Dr. Olugo mentioned, before you dispense any particular drugs or prescription, because you fill and dispense, you need to screen those prescriptions for interactions, check for side effects before you attend to it at all, to avoid medication error. So you can use this application. The Medscape is free,
Okay.
Hypocrite is free, Doctor.com is free. That's my additional information.
Okay. Thank you.
Is Pharmacist Musa here? I think you missed most part of the presentation. You're welcome. Pharmacist Musa, are you there?
Thank you.
It's good to have you here. Any other question or contribution?
Hello?
Pharmacist Alege. Yes, sir.
I think pharmacist.
I think we should be planning to round up when there's no.
Okay.
Attendance. How do we improve this?
Oh, okay.
I think what we do is to continue to do it every month, and to continue to encourage our members to join. Some people maybe because of network, some people maybe because we are not doing. At least this is the first this year, so it is our plan. At least with the Pharmacy Leila, being the state coordinator now.
Yes, sir.
Sipan Kwara State. So the onus lies on you now to work hard on the people of the state to ensure that the next one is well attended. This is the first one for the year. So if I go to the next one in April and in May, we'll work on more people to join us.
Yes, sir. Yes, I'm really brainstorming on how I can improve CPAN. So there's a couple of things in the pipeline. Yes, I will. Because of the fasting, basically, it's really dragging me down. Fasting is going to end very soon. So, yes, inshallah, before the next.
And then I was going to ask.
Yes, ma'am. Go ahead, please.
I was going to ask. Ma'am, that at the lectures every last Friday, do the lectures come up every last Friday of the month?
Dr. Ike, is it every last Friday?
Yes, for CPAN, for the state branch of CPAN. All the state, yes, every last Friday for all the states branch of CPAN. So if you go to all the state now, we have in Benin State, we have in River State, all these branches of CPAN are having their lectures by this time. So we are happy to be part of the state that is presenting. It's not easy. How about 20 states? But only 10 are presenting today. So it's not easy to organize a meeting. It's not easy to even call people to attend. But we're happy to be part of the state that is presenting today in CPAN.
Okay, thank you.
Yes, Dr. B, I'm suggesting, sir, that maybe we can tell the PSN executives, maybe it can be included in the announcements during the PSN state meetings.
Okay.
The CPAN seminars, the online or the virtual seminars are last Friday of every month.
Okay. And 9 p.m.
9 p.m. last Friday of every month.
Fambelo. Hello,
yes, sir.
Hello.
Yes, sir. From Alege. Go ahead.
Marry you.
Yeah, from what you have said, the fact that is taking place concurrently across the states.
Yeah. Yes, I will say yes.
Yes, could be a factor why attendance. For example, if a neighboring Kogi state is presenting another topic that is of interest to some individuals, they may prefer
yes.
rather than join the home group. So, but then you are limiting us to get access to education. So if ours comes on Friday, last Friday of the month at so time, I think you should scatter the time so that even we can have the opportunity to join other states. Otherwise, we only restrict us to our state. I hope you understand that.
Okay. Thank you, Dr. Alige, for that one.
I'm not a
Yes,
doctor.
it's not necessary to have it at 9 p.m. You can shift the time to another convenient time that will allow more people to join, like you rightly observe. We can have it at other time than 9 p.m. on Friday, so as to allow other people to even join us on other states.
Yes. Thank you very much. I wish you.
And that will be decided on by the ESCO.
Okay, thank you.
All right. Thank you all for your contributions, for your presence. Also, you're highly appreciated. Pharmacist Yunus Ahmed Tijani, you have a contribution? Okay, Pharmacist Ahmed Tijani is saying that one of the major factors of the low turnout is lack of awareness.
Pharmacist Bello to this regard, honestly.
Yes, sir.
Yes, go ahead, Pharmacist Ahmed Tijani.
I think one of the reasons why I had brought out the issue of low awareness is not on the, pertaining to the awareness to members, in the states. But as far as I'm concerned, the CPAN as a platform, for me, I'm just seeing it for the first time in Kwara State. I have seen it in various states. In fact, when I was in the FCT, I was part of the member under the leadership of this farm Sunday following show. Well, it was just today that I saw this, I came across the invitation for this Zoom lecture. I so much believe there could be one or two other members who might be hearing the name CPAN for the first time, especially in Kwara State here. So I think people need to be more enlightened that CPAN has come to stay in Kwara State. Thank you, ma'am.
Yes, the new ESCO will look into that, and yes, we're going to make awareness. We're going to make awareness, and we're going to make our monthly meeting standardized and increase the awareness basically. So we're working on that. Like I said, things slowed down because of the fasting, but fasting is going to end very soon, and yeah, we'll work on the awareness.
Okay.
So we'll seek your Pharmacist Musa has a contribution. Oh, okay. Pharmacist Musa is suggesting that if we can all mute immediately we speak, we'll be able to hear the other person speaking. So I think the voices are all muddled up, different people talking. Okay, yes, we'll look into your suggestion. Thank you, Pharmacist Musa. Thank you, everyone. It's almost 10 o'clock. In the absence of any other comments or contribution, we thank everybody for attending the first CPAN clinical meeting for the year 2022. And we hope the next meeting will have more attendance and more interesting lectures to disseminate. And thank you, everybody, for attending today's CPAN. Happy Salah in advance.
Same to you. Thank you, everybody.
Thank you very much.
Good night, everyone. Enjoy your weekend.
Good night,
and
ma'am.
the holidays.
Thank you very much, ma'am.
Good night. Thank you.
Thank you too, ma'am.